Your local community clinic didn't just get a new logo, it became part of a regional monopoly that's draining your company's bottom line. Many of these behemoths, including nonprofit systems that pay no taxes, quietly eliminate competition, they hike facility fees, and they manipulate referral loops. You're not just paying for healthcare, you are funding a corporate takeover. Okay, here's how it works. A hospital buys the doctor's office down the street. Same doctor, same exam room, same parking lot, nothing changes except the bill. Overnight, that office becomes a hospital outpatient department, and a new line item appears: the facility fee. You didn't get more care, you got a more expensive address. And the gap is staggering. In Texas, a colonoscopy at an independent surgery center runs about $1,000. The identical procedure at a hospital owned outpatient department, close to 1,800. Same scope, same biopsy, almost double the price, all because of the building. A lab test in a hospital outpatient department costs more than 3 times what the same test costs in a physician's office. Not 3%, 3 times. And this isn't a rare loophole anymore. In 2012, fewer than 30% of physicians worked for a hospital system. And by 2024, it's more than half. Optum, who's part of UHG United Health Group, alone employs 100,000 doctors. That's about 10% of all physicians in America. 10% of doctors are working for an insurance company. I've been through an Optum acquisition. Trust me when I say things change overnight. So why isn't anyone stopping it? Because it's invisible by design. A giant hospital merger makes headlines and draws regulators, but buying one small practice at a time kind of slips under that federal reporting threshold. So nearly every one of those deals is too small to trigger an antitrust review. So they don't merge once and get caught. They acquire 50 times and never get noticed. Sneaky, sneaky. The result is 90% of US hospital markets are now officially highly concentrated. And after acquisition, physician practices rise about 14 to 15% on average, with zero measurable improvement in quality. Mortality rates don't drop, care doesn't get better, the invoice just goes up. Do you think the insurer is going to eat this? No way. Rising hospital prices pass through almost dollar for dollar into your premiums. And economists who trace the data found something brutal. When health prices rise because of a hospital merger, the people who lose their jobs aren't these bigwig executives that make 7 figures a year. It's the middle income workers that make under 100 grand a year at companies that have nothing to do with healthcare. One study found that for every 1% rise in healthcare prices from a merger, payroll and headcount at a non health employer company drop measurably. Unemployment ticks up and wages stall. Your benefits line item isn't just a cost, it is a tax on your payroll, and your own employees are paying for it in lower raises and lost jobs. So, where does this all go if nothing changes? Half of physicians employed today becomes most of them. The independent doctor becomes a memory, fastest in rural America, where they're just vanishing now. Facility fees are going to continue to compound. Premiums compound, referral loops tighten until your employee can't get care outside of the system that owns their doctor. And the one fix that nearly everyone agrees on: site neutral payment, paying the same price for the same service regardless of the building, would save, are you ready? Roughly $157 billion over 10 years. And it has bipartisan support, but it still hasn't passed because the hospital lobby is one of the most powerful in Washington. Those lobbyists give more to politicians than oil, defense, and tech combined. How is that possible? So, no, your clinic didn't just get a new logo, it got a new owner, a new billing code, and a new mission, which is your money. So, the next time a CFO tells me they can't control healthcare costs, I'll tell them the truth. They can. They've just been funding the takeover that taught them that they couldn't. Sneaky. If you are a CFO or a finance leader or an HR executive and you have never seen your plan's facility fee exposure broken out, that's not an accident. It is literally the business model. Follow for the parts of your healthcare spend that nobody's incentivized to show you. And if you want to know what this is costing your company specifically, send me a message and I'll show you where to look.